cases that I tend to be asked to look at will be cases where neuroimaging has either been the main area of radiology that's been involved in the diagnosis, or sometimes where other experts have got there before me, as it were, and have said, here's our overview of a case. We found an issue that we're not sure about, and it pertains to the neuroradiology. And that's a situation where I'm often asked to come in and look at a discrete part of a case and answer a specific question that's arisen through the investigations of other experts from other areas. So that sometimes happens. And that's an easier situation in terms of it tends to be quicker to arrive at an answer if there's a discrete question on a particular scan. So one case that I had fairly recently was the question of whether the correct diagnosis had been made on a patient where the weakness that a patient had experienced in an upper limb had been attributed to a peripheral nerve problem. And the question was that a safe diagnosis? And the neurology expert had asked for a neuroradiologist to come to have a look at the case to see whether that was a safe diagnosis. And very surprisingly, in a sense, when I came to examine the scans that had been done at the presentation, I actually found that there was evidence and quite clear and compelling and unequivocal evidence that the initial diagnosis that had been made was incorrect. It was not a peripheral nerve problem. It was quite definitely a problem with the central nervous system, in so far as there was an area of infarction within brain tissue, which was the cause of the upper limb weakness. And this really was somewhat surprising because the expert on the other side had appeared to have overlooked that small detail on the scan. And when it was raised by me, there was no challenge from the other side. It was accepted. And it really did turn the case around, because it was then quite clear that the original diagnosis had been unsafe, incorrect, and it was no longer defensible from that breach of duty perspective.